Hey everyone, Chris Lewis from Fox 47's Digital Newsroom. Today we're talking about COVID-19, we're talking about coronavirus, and we're talking with Kris Allen, who is the Chief Nursing Officer and Clinical Administrator for Michigan State University's HealthTeam. Kris, thanks so much for being here today.
Absolutely, you're welcome. Thank you for having us.
Now I know that you are in day 2 of your Drive Up testing for COVID-19. And I'm guessing that there is somewhat of a progression that led you to now be doing the drive-up testing. And because, I know that this has been progressing along the way. Can you talk to me a little bit about the progression that led you to this?
As fast as everything is changing and moving through this crisis, really it's been we're going into our second week really in kind of the main focus of the crisis. And the things that we've generated that first came up was a COVID triage line that we partnered with our colleges, College of Human Medicine, College of Osteopathic Medicine, and the College of Nursing. And that is manned by all of those students to be able to have a resource, because first it's just questions, right? That's kind of what generated at the beginning of what do I do? What does this look like? So we stood that up the first of last week with that collaboration. And then after that, we really have put a lot of efforts and focus on telemedicine. So we've changed majority of our clinics, all of our clinics, to about 80 to 90% of their visits currently now are telemedicine visits. And to stand that up in a week is huge kudos to the team for doing that. But to keep obviously everybody in the focus of social distancing and the orders of stay home, stay safe, it was very, very important to make sure that we were still delivering care to our population. We have well over 30 clinics that we focus on for specialty and primary care that we wanted to make sure that we stayed in connection with our patients as they stayed home. So that was another generation from that. So as we have the resource line and then the telemedicine, the next step as we're progressing through this crisis is testing. There are some tight sites here locally that do have testing availability, but not in our area. Just this side of town. So we felt that it was, we have a large patient population. We are the largest practice and specialty clinic practice in the area. So we felt that it was very important that we allowed that access to the testing. So we took our triage line screening protocol and we put it live into our testing protocol at the testing site. So yesterday morning at 8:30 we started. You have to have a physician's order to come to our drive-through testing site. That order can be in any form or fashion. It does not need to be a written form. It can be electronically. We have access to a multitude of the EMRs in the area, and it can send it electronically through our portal and whatnot. So it can come in any way, on your cell phone, by email, any of those types of aspects for the order. That tells us that, first of all, you've been to a primary care practice and you've been screened to the symptoms, and I can talk to some of those symptoms. And then we pre-screen, then we rescreen once you've gone on site as well, just to make sure, because we continue to still make sure that we are vetting out the individuals who are symptomatic, because those are the ones that are the highest priority currently right now being tested.
So talk to me a little bit about the symptoms, because I know that I've read about them and people have probably heard about some, but what type of symptoms should someone really be having to kind of take that next step, to go and talk to their primary care physician and to potentially go and get tested?
Sure, absolutely. There's a couple of guidelines that we're using, because COVID-19 presents itself very similar to our influenza A and influenza B, right? So that's where some of the confusion is in regards to that. So some of the basic ones for COVID-19 are a fever greater than 100 is based on CDC guidelines that continues to kind of creep up in fashion over a certain amount of time. After you've been exposed to COVID-19. So fever, a cough is another one that is common. And then there is starting to see a little bit of diarrhea that's been added from CDC guidelines as well, that's been on there. And then, sore throat and nasal congestion. So they all sound like the common cold. Fever has been a very common one. Actually, the Ingham County Health Department just put out a great document that we can use as a resource on their website that has the symptoms of all three, influenza A, influenza B, the common cold, and then COVID-19. And it can kind of see where some of them are common Again, I wish we all had the same symptoms, right? We could say, oh yes, that's it, and we can test for that. But everybody kind of presents in a different way. But what we are seeing as a common theme is definitely a temp that comes down a little bit with some medication, but doesn't stay down. And then body aches and fatigue are another one that we're seeing when you get into several days of the symptoms. People are really ran down and very sick. Shortness of breath. Sorry.
Okay, yeah.
That was the other thing. Yeah, shortness of breath or difficulty in breathing is another one, because remember, it's moving into the lungs at that point. So it's kind of wreaking havoc on breathing.
Now, another question that I know that people have had, and I don't know if you can answer this question or not, is in regards to home treatment in trying to deal with some of the symptomatic aspects. There's definitely been some rumors out there about what you can or can't use, taking, ibuprofen versus aspirin versus other things to deal with some of the underlying issues, or if some of those things can make your condition worse. Can you talk at all about any of that?
I can touch on a little bit. To be honest, I have not seen where Motrin or ibuprofen has caused any increased inflammatory, but I don't have all that expertise. I can tell you that in working through some of the individuals with symptoms that we're managing, not being COVID-19, but just being A and B, is sometimes it helps to alternate between Tylenol and ibuprofen or Motrin to help control that fever. But we have not seen the evidence that it has impacted people in regards to that effect.
I appreciate you sharing that. Now, if someone does come up to your location, tell me first where the location is, but also what should someone be expecting when they drive up and are looking at getting tested?
Sure, absolutely, yes. It becomes so real when you're out there fully in our garb and driving up. So we really want to make sure that we're giving support to the patients and their loved ones that are there with them as well, because it is kind of scary. This is a time that none of us have ever been in, right? To be in this situation. But when we talk about access to the testing, it's really the convenience of the concept of staying in your car, right? Limits the exposure to others, not just us as healthcare workers, but to anyone else. And then it keeps you out of the ED, because that's one of the main focus too. We want to make sure that the emergency departments have the ability to take care of patients that need that emergency care. So the focus of COVID-19 has always been to really try to treat at home or stay distant, the social distancing and whatnot. So the drive-through testing allows us, we have a check-in tent that's at the first where you drive up. We keep our 6-foot social distancing there, with the window that's down just a small, with individuals that have full face shields on, as well as N95 masks, and have a conversation to just, for A, confirm that they have an order, B, confirm the patient's name and their date of birth so we know who we have. And then we're putting things on the windshield, and then they proceed to the tent where we do the testing at, which is down and around the corner. We are then in the tent. They drive through the tent and into the tent, where we have 2 nurses that are swabbing, kind of assisting in swabbing. So it's a nasopharyngeal swab. So what does that mean? It means it's not only in the nose, but it also needs to go into your pharyngeal area. So it's quite a distance in the nose. It is uncomfortable. However, it takes about 10 to 13 seconds is when we insert the swab into the pharyngeal area, after we have you blow your nose and clean out your nasal passages. Kind of burns, a sensation, makes you cry. It is uncomfortable, but it doesn't last very long. And people have been definitely very appreciative, obviously, of being able to do this in an easy manner. It takes literally just a couple of minutes, and then they're on their way. We do provide them with some fact sheets, again, continuing to enforce them to stay safe, stay home, self-distance, and social distancing, and making sure that if anybody else that they've been exposed to or have been in contact with in their family, that they continue to monitor symptoms.
Now, for individuals that do go through this testing, how long does it take to get the results? But also, if they get a positive result, what does that really mean? Does that mean they have to go right to an emergency room? Does that mean they need to stay at home? What do you tell people?
Sure, absolutely. Great question. Definitely don't go to the emergency room if you just because you have a tested COVID-19. Remember, emergency is for those urgent matters. Once we get the result, actually, we've been seeing some great turnarounds on our results. It's been about 48 hours at the most for our results. That's a huge, huge improvement in us being able to take that next step of treatment or exposure, limiting exposure once we have identified people who are COVID-19 positive. So once we get the results back, and remember those orders that come in are usually from primary care practices, so they're getting those results as soon as we get those, and then we're calling and following up. So today we followed up on everybody that was here yesterday. So that's important depending on the results, because then if it's not COVID-19, you need to treat to, obviously, maybe you need to do an A and a B flu test or whatever we need to do from there. So that's what we've been doing so far.
Well, I really appreciate you being here today. If someone does want to go, can you remind people of again, where you're located and when you're doing your testing?
Yes, absolutely. So testing is done right now currently until, based on volume, is 8:30 in the morning till 12:30. We are at the clinical center, which is on Service Road here on the university campus. It's 804 Service Road. There's a large white sign out front that says COVID-19 testing. And we are there 8:30 to 12:30, Monday through Friday.